Hello, and welcome once again to the Good Life chat room. I'm your host, Sedina Mbaku. On today's segment, we discuss the new visitor in town, Mpox. And to better understand this, we have an expert on the show. He's going to take us through what Mpox is, the preventive measures, the transmissions, and also to ensure that we live healthier and safer lives as Ghanaians. And so with me here today is Dr. Joseph Oliver Commey. So welcome, Doc.
Thank you very much for having me.
Okay, so before we start anything, would you mind telling us what you do?
I'm a very simple person. I like viruses, so I'm an infectious disease specialist and currently the director of the Ghana Infectious Disease Centers and a member of the National Case Management Team. In this respect, I'm also the Mpox case lead.
Okay, so viewers, as you can see, we have the right person here for the job. And so, Doc, I'll start with what is Mpox?
Okay, so Mpox is a disease caused by the monkeypox virus. Hitherto, this disease was called monkeypox disease, but because of the stigma associated with monkey, we removed the M, or we shortened the monkey to Mpox. So it's Mpox disease, but the virus is the monkeypox virus. The monkeypox virus belongs to the same family as the virus that causes smallpox and chickenpox. So we'll say smallpox is their big brother, mpox is their second, and chickenpox may be the third.
Okay, and people, I don't know whether to say, confuse Mpox and smallpox. What's the difference or correlation?
So, like I said earlier on, the big boss was smallpox.
Okay.
But smallpox has been eradicated. So, far back at 1980, smallpox was eradicated. So, since that time, nobody has seen smallpox again. So, what we are seeing now is monkeypox, and then the other one will be chickenpox. Okay, so we'll tend to compare more chickenpox to mpox as compared to smallpox because that is no longer available.
Okay. So, what are some of the causes of Mpox?
Mpox is caused as a viral infection, like we said. The main transmission mode is contact with the fluid from the blisters that you see in Mpox, or contact with the beddings of the person who is infected with Mpox, or if the person has touched certain utensils and left some of the viruses on them, and you also pick it up without washing your hands, then you introduce the virus also into your body. Mainly people talk about contact, close contact. That means that sexual contact is also considered one of the modes of transmission for mpox.
And what steps are we taking as a country to curtail? Because when the news broke out, there were people had this preconceived notion that we have started another pandemic for money because the dollar is coming down. We want to source for money as a country because we are broke. We are, but then you are the expert. You know what you have seen. So, what steps are we taking in that direction to ensure that people take the information seriously? Because once people start saying things like this, other people might not. So they might see the signs and just, oh, it's one of those things.
I believe one of the discussions or why we are seated here is to make sure that we allay the fears of the Ghanaian public. We had 5 cases of mpox last year.
Okay.
If the system wasn't ready, if the system wasn't that robust, I'm sure we would have said, what's happening? But nobody heard about those cases. So why are we making noise this time? I must say that from late last year till now, the West African sub-region has been experiencing an increase in the number of cases of mpox. Next to us, Cote d'Ivoire is experiencing cases. Nigeria is experiencing cases. Can you believe that as of December, Sierra Leone had recorded 1 case? Currently, Sierra Leone has recorded over 2,000 cases. That tells you that we need to make sure that everybody knows about mpox. So maybe when we got our first case in February, there was no need to make so much noise about it. But when you got 2 and have 2 more 4, then we needed to make sure that everybody now is aware of Mpox. So unlike COVID, which is a new disease, this we know already, and measures have been put in place to address it. It's just because it's happening within this West Africa sub-region, we feel that Ghanaians need to know what is happening, know about the disease, so that maybe others may be hiding, we could pick them up, and then we will manage them. Mpox is not a deadly disease, that has to be said. Measures put in place, whenever we have an outbreak, so Mpox, one case is an outbreak. So whenever you have an outbreak, we activate what we call the public health response. So there are several pillars. We have the case management, for which I lead. Then we have the risk communication, for which the health promotion leads. Then we have coordination, we have surveillance. So at the moment, everything has been heightened. When we talk about case management, almost all our isolation centers are on standby to manage the patient. Those who need to be isolated will be isolated. For contact tracing, surveillance is on heightened suspicion. Then the other ports are the points of entry. So our temperature checks will go on, especially for those coming from areas where we feel that there's an ongoing outbreak. Then the labs have been strengthened such that Mpox is diagnosed within maximum 48 hours. So you see that all these things have been put in place. We did that last year. We just have strengthened these things again. And then health promotion. That is what we're doing now. We're discussing the real issues of Mpox so that everybody knows that this is just a disease, just like chickenpox. But we need to know because it's just spreading from country to country. But there's no cause for alarm.
Now let's go to the streets and hear what people have to say about Mpox. We'll be right back.
Hi everyone. So today we are here at the Akotolo Anti-Lorry Station to engage with the community members. We want to know their knowledge on the trending Mpox in the country. My name is Rachel and I'm here to stay tuned. Mpox yari no what pain.
Matipe, but Joseph Masumana, Joseph Faneko.
Into ye no mo say Mpox yari ben.
As a Minister Amukano, once I used to radio and TV. Yana say me Juma, I just say.
Okay, and the Mpox yari no. Say, ope se unhu so bi enye bia. Before say obehu say 50 san no kra aba begu ne ho no. Na obenya bibi say headache, fever, na ne bosofuno ne ajaja say tanya malaria pese yewa but for some days bona rashes ababa begu ne ho. Enti eno sa no onya ho bibi sa pe na wama nipa na ko hospital na odi nipa na ko hospital. Ochini ho Ghana Health Service bariake helakoi bagana achole Mpox. Onu Mpox da.
Find out.
Onu kodoko.
Find out.
Woka obey wale. Ke una fever. Alo una rashes yo here. Me no feel.
My nearest health center.
Okay.
Dolele de deva afi wa start ya anabe fever na low ota avel ta na ekpene ne ma jebe na ide konji kaba alo na ekpobo o la me gbe ko jebe na ide konji na wa pogbo kaba hafi wa ba o late ape
Pacho na watchi money na what to say ye boy yare bi hunde ro say yare bi abana.
ai mati
Pacho yare be ya.
esi a friend monkeypox.
Pacho den na what fa yare no he oti ye say aye den ya.
Okay, me the meti say no more kan o radio so na meti na omo bisa doctor bi na o kire me say mboa na de ba monkeys na say obi a otai ko nrum na ko ye sa hantin ne ma no omo na omo tai na omo so na sa yare na eba na egu ho a ye tse de awo bi pese de o na say pese malaria bi pese chiu na ben say wo bo wan kiti bi so na be nso award do nti at the same time be nso say I say we so bibi nkitinkiti bi gu say rashes nti yes na wo say wonam so aye oboyo bi mu free fine o say wo gbomodian na wo kɔ hospital na omo hwɛ nti ni say eba ne sa wo tena fie na ka omo because omo che say esane nti me de sa na mete nti so wo do hospital omo de wo be hye machines no mo ehu yare say ya nu abi potia na omo a quarantine wo se bibi sa na omo ka bibi ana nti omo se asat na nipa 4 na omo enye bi se 5 nti ye se omo a quarantine mo health service wo kulubu o se bibi sa sa na me de mate
Patrona na wo ka say almost say a sign. Fine a fast sign.
Oh, no dear ma nhyeda anti ho no but me so say I say ye to set covid the year no ni say wo bemben obi but ma anti nkyeremu no yi say sane ane sane me ti bibi sa
Anti say obi hwe wo say a then na wo pese wo ka che abonten so for fire we no ho me hu ni say what's nim de bebre afa ho nti amom wo abonten mo nte ye na den futuo na wo betu o
oh me de nka me tu o mo mo wa mo futu anka me ka che so bia nhwe no ho yi e fan we didie mne bia o 90 mne fan say environment so e betumi aka ho e bia say bia fi bi ba baby ana baby ho anye bi eno so betumi akos nti obia o so hwe na edidim na hwe na se ne obeya bo ne abrobo na obobo no final atse ho na ma ntumi ankwankwan saa yare ni bi me de saa na nka maka
o fana achomi ni lante nje Jamestown British Accra
ochini ho ne Ghana Health Service birthday announcement kwa ke hela kweba 2025 ne o fa no no
o fana e se o fana mi nuku
onuko hela ko nieba
o fana nuku hela ko nieba
shionu hela ko ni achole Mpox down
o fana da bi
2024 ke 2023 wona Mpox ye Ghana onu
o fana da bi wanyo explanation no cho ekule egbe no cho ni nlegbe se ekule ila be ni ila sinti se yo nle ila lo no cho le nle
okay ko be he wale mi no fio
o kembe wale maya ila chamoye keji na ke o feel fine npa mi che mi maya ila chamoye ko ni ma ka ma ke o ni kenken di no ni fio e kura ba ka ke o yan feel lab ke yan feel lab report ni yo na ba mi chofa lo lo di no ni fio kembe wale
okay Mpox hela etumo chickenpox ole chickenpox
o fa ne
ke je shishie eshishije mo tamo malaria ewo obana o temperature ba ya nwe o icho ba agbabo body pains obana body pains nakani Mpox hela yo
okay
chike ete nwe fio obana ke rashes agbo eba o body tomo beni chickenpox fio shene ke baba oninemi ke onaji
okay
shife odemisi nakani Mpox yo wo wonta o ni wo Kenya keke onna lokota monakalo ni ka olemo koni ena lokota monakai e rashite hospital money wo hospital for amevanya amekwame juba
okay.
Welcome back from the streets. So, Doc, it looks like a lot of people are not aware about Mpox in the first place, and also signs and symptoms to look out for when it comes to Mpox. So, can you tell us some of the signs and symptoms?
Typically, Mpox will start with a very high-grade fever. So, this, all of us get fevers, but then they'll say this fever is too much, headaches. Body is hot, usually around 30, 40 degrees Celsius. Then they may develop a sore throat, or they may develop joint aches. And then usually after about 3 days, the rash breaks out, starting from the head and then involves the whole body. Typically, the rash also involves the palms and the soles of your feet. Then we've also noticed, what I described first was the typical presentation. But we've also noticed that we have atypical presentation that doesn't follow the usual. And in this case, you tend to have people with sore throat and a lot of genital lesions. So sores around the vagina, the penis, or the anus, the perianal region, sore throat. Very few rashes on the body. But when you open up down there, you see a lot of rash. That's the atypical presentation of Mpox.
So, viewers, like Doc has mentioned, maybe in these times you're having some sore throat, you've seen some lesions, unusual lesions somewhere, and maybe you're thinking, oh, it's just one of those things, or it's the weather, because the weather is hot or it's raining. So, maybe you should just take steps in finding out what is wrong, because you may never know what is happening. So, now, is there something we as a people can do to help the health ministry in also addressing this issue?
Yeah, we as a people, we need to be each other's keeper. I'm sure if you've had chicken pox before, whenever anybody has chicken pox, that person is isolated. Even your own brother, you don't go to their room, they stay. The same with Mpox. So just take Mpox like chicken pox. Once you get chicken pox, you know you need to stay away. Once we say you have Mpox, it's the same. The other thing is that let's try and avoid contact with the rashes. So I will say that in TB, when somebody has TB, we say you cover your cough. So when somebody has Mpox, we say cover your pox, so that you wear long sleeves, you wear trousers. If it's a lady, long blouse. If you need to go to town, let's say to the hospital, you need to pick public transport. You have Mpox, or you are suspected you may have Mpox. Cover it so that the person sitting next to you is not affected. Key thing is that maybe we touch things, and we say it's contact. So it's our hands that really touch things. What do? We wash our hands with soap and water. If we have the hand sanitizers, we use them. Another way is that you avoid contact by not shaking people. So, hello, how are you? I'm good. Once we do these things, I'm sure soon Mpox will be something we are not talking about again.
As a people, anytime there's an outbreak of a disease, the issue of stigma comes up. The fact that we know someone who has it, and then we go about trying to avoid them because we don't want any issues. What are we doing about stigma? Because we can't do without it.
It's good you asked this question. I always will say, when you see Mpox, think chicken pox. Do you stigmatize people with chicken pox?
No.
So you don't need to stigmatize anybody with Mpox. But remember when we spoke about the transmission, we spoke about some sexual.
Yeah.
So anything that has to do with sexual, that is sexual transmitted in nature, then we add stigma to it.
Yeah.
I want us to know that Mpox is not sexually transmitted. It's just that sex is a contact activity. So when I have Mpox in my genitals, definitely if we have unprotected sex, you will also get Mpox. However, it is not transmitted through semen, and that is the sexually transmitted part. So please, if anybody has Mpox, it doesn't mean that that person has been sleeping with somebody else who also had Mpox, okay? Most of the transmission is contact. So there's no need for us to stigmatize anybody with Mpox.
So, Doc, I know I said this was the last question, but if I start having or feeling symptoms of Mpox, if I walk to the facility, what should I expect?
So the first thing is that because you have the fever, you have the sore throat, once the rash breaks out, think about going to the hospital. When you also go to the hospital, let them know why you are there. So maybe at the front desk, you say, I have a fever, but I just developed this rash. Let them know at the very beginning so that they will more or less take the necessary precautions so that other people seated will also be protected. In that case, you are fast tracked so that we can know what we have to take the samples early and we all know what we have to do. So don't feel shy about it at all. Rather get there quickly, say it, and who knows, you won't spend too much time in the hospital. You are quickly sorted out.
Okay. So thank you very much, Doc,
Thank you for having
being here
me.
today. We've learned a lot from you. We're also
Thank-
grateful that you were willing to share this information with us.
Thank you too.
Viewers, there we have it. We have heard from the experts themselves. Let's take steps to ensure that this new visitor does not stay. And also remember, Mpox is not a deadly disease. Thank you.